Hi everybody, I'm Maureen Richards. If this is the first of my videos that you're watching, welcome to Rush. I am your discipline director for microbiology and immunology. So once you matriculate here in the fall, you and I will be interacting a lot because I'm also your course director for the host defense and host response block. So let's get into some immunology. This video is really to lay the groundwork for some of what we'll be talking a lot about in the fall, and namely that's inflammation. So what exactly is inflammation? All of us have experienced at some time in our lives and could probably describe it really well, but we don't necessarily have to come up with that because other people have spent a lot of time doing that. So the immune system is the body's rapid response to an attack on the body. And I do mean rapid, so things begin happening within, seconds. And inflammation can occur for a variety of reasons. Blunt force impact, as is kind of indicated here. Obviously, this person seems to have rolled their ankle, sprained their ankle, because you can see it's very inflamed, a lot more than the other one. Penetrating tissue injury like a needle stick, or a splinter, something like that. Response to an infection caused by a pathogen. So most of us at some point in our lives have experienced the dreaded strep throat, where you feel like you can't even swallow. You got it. That's inflammation. Exposures to chemicals, irritants, and toxins can also lead to inflammation. Really just that's your body responding to it, trying to clear it out. And then extreme temperature as well. So burn victims will also experience a significant amount of inflammation, as will patients who have been exposed to very cold temperatures for a prolonged period of time. So all of these things will lead to the inflammatory process. The inflammatory response protects the body basically by isolating the area. So when we think about inflammation, we'll talk about this more in a minute, you need to remember that all of our tissues are lined with blood vessels here, okay? Now, the blood vessels are basically the highway. So for those of you who live in the Chicagoland area or are moving to Chicago, let's imagine our blood vessels are like 290, which I spend a good chunk of my day on every day. Now, if I come in very early in the morning or leave very late in the evening, I fly down the 290 highway and am home in about 45 minutes. But when I normally come to and from work, it is congested. It is inflamed with cars and people trying to get to and from work. So that means I'm not going to be able to get there as fast. And even the exits off, or the capillaries that kind of feed the tissue, may become inflamed, right? So some cells will be trying to get in there, and those are inflammatory cells. But the tissue itself is also kind of cut off, and that can provide a lack of function. But it also, if you've got an infection or a toxin or something right in an area, it tends to isolate it there, so that it isn't spread throughout the rest of your body. That's the goal. It doesn't often work that way, as we'll talk about during your curriculum, that there are a lot of systemic infections and systemic effects of toxins. As healing occurs, the inflammation goes down, and you can see kind of the long-term damage. So there are 5 symptoms, basically, of inflammation, and let's just kind of go through them one by one. And most of you can probably name these without me even talking about them. But the first one that we all associate is pain. So pain makes sense, right? Just like what I was talking about earlier with strep throat. It's difficult to swallow, right? And that's because the lymph nodes and the tissue in your throat is all inflamed. So the first thing we see is an increase in pain. This is basically because there are chemicals that are produced as part of the acute inflammatory response, most notably bradykinin and histamines. Most of us have heard of histamines before. You see it on a whole bunch of allergy commercials, which if you're watching this over the summer, you're probably seeing a lot of those. Bradykinin and histamine are able to stimulate nerve endings in the area, which makes the area much more sensitive, which is why we experience a higher amount of pain. Okay, number 2, I'm going to change colors, is rubor, or basically redness. The skin is likely to become red, and part of this, again, is due to the bradykinins. The bradykinins are basically a potent endothelial vasodilator. So what does that mean? So let's go back to our analogy of the blood vessel, okay? The walls of your blood vessel, as you will learn from your histology professors, are made of endothelial cells. And these endothelial cells are tightly packed together, particularly with something called tight junctions, right? So these junctions help the cells stay very, very close. And that's important, right? Because we don't want the blood to leak out all over. We want it to stay in the blood vessels and only go where it's directed, okay? So what happens is bradykinin basically comes in here and removes some of these tight junctions, or loosens them. And that way we're going to see more blood flow into the area. And when we see more blood flow, we also see more redness, okay, because of the greater blood flow to the area. The other thing that happens is we get an increase in heat. We see an actual change in temperature. So if you think about this, I'm not necessarily thinking about fever. We'll talk about that in a minute. But heat is also a reason for the redness. More blood flow into the affected area makes it feel actually warm to the touch. And you can think about this if you've ever had a lot of people get it after they've had a vaccine, right? You get a vaccine in your arm, and then for the next day or so, it's painful, it's a little red, and it might be a little warm to the touch. This is a product of not only bradykinin in the area, but also work of the acute inflammatory response, which is literally the work of something called cytokines and chemokines, which we're going to talk a lot more about. As far as immunology goes, if you want to be successful at immunology, which I'm sure you all do, you absolutely have to know your cytokines and chemokines. Cytokines and chemokines are the hormones of the immune system. They are how immune cells communicate with the world around them. It is speaking their language when you learn cytokines and chemokines. And they actually play a huge role in this. Okay. We can't have all of these cells coming into the area without swelling. So we've got increased blood flow, and with increased blood flow, we have increased trafficking of cells into the area. So we've got increased permeability and leakage of plasma proteins and tissue, and that's what's going to cause edema. That's what a lot of people have probably heard of before. You've got this influx of blood, white blood cells, leukocytes, particularly a specific type of leukocyte known as neutrophils. We see them show up pretty early in most infections. And these are all responding to the inflammatory event. So that's why we see this swelling, as I showed in the last image. Okay, and then the last one that you might see is immobility. And anybody who has ever had an orthopedic injury understands this well. I was a competitive figure skater for 15 years. My knees look like I am significantly older than I am. And I was always banging up my knees. And anytime I threw my kneecap out of its socket, I could always get it back in. But the next day, that knee wouldn't bend all the way and wouldn't straighten all the way. And that was partially because of the swelling and the pain. So basically this immobility, all that swelling in the area temporarily cuts off. And one of the goals of that is to isolate a pathogen in an inflammatory event. This is typically a temporary loss of function, and it'll resolve as the body goes back to baseline. So when we're thinking about inflammation, all of us have had what I'll consider acute moments of inflammation. So strep throat, that was acute. It went away. Your throat didn't stay inflamed. You didn't have trouble drinking for the rest of your life. I'd throw my knee out in college. It would come back. It's fine. This is because your average inflammatory event is a transient event, right? We deal with the problem, we recover, we move on. Now, let's say you have some sort of inflammatory event that we can't quite move on from. So something chronic, okay? So this could be something like an infection. There are chronic infections, particularly like HIV is a good one to think of. This could even be something like cancer, where you might have a response to that for a long period of time, or autoimmune disease, which we'll talk a lot about during your curriculum this fall and throughout the next 2 years of your lives as med students. So acute inflammation is going to occur within minutes of an injury, like a cut, splinter, insect bite, whatever, and it's going to take several hours to fully activate. In cases of like a bacterial infection, it'll then resolve over the course of days. Chronic infection, on the other hand, lasts for months to years, and in some cases, the symptoms never abate. So for now, we're going to focus on acute inflammation. Okay, so in the acute inflammatory response, there are 4 global stages: initiation, amplification, destruction, and termination. So let's take them one at a time. Initiation is easy. We got to start things off. This is all the stuff I just talked about. We're talking about increased blood flow, right? Because we're going to have more vasodilation, more vascular permeability. That's going to occur from damaged blood vessels, leading to influx of fluid from the blood. The blood is going to contain a lot of factors that are going to propagate the response further, and that's going to lead to that vasodilation. So those factors could be things like histamines, bradykinins, and other mediators we'll talk about. This is also going to lead to smooth muscle contraction, right? Because we're affecting those more sensitive nerves, and also pain and swelling and heat, like we talked about on the last slide. This is all going to be discussed in more detail in future cases while you're here at Rush. All right, amplification. That's kind of the next stage. Once we started it, we want this movement to continue. We don't want the momentum to die. And so we've got to have a couple ways to basically convince the body that it needs to respond, that we actually need to mount an attack against this pathogen. So amplification actually occurs as a result of a network of inflammatory responses. So we've got a couple of things. First off, we've got secretion of basically inflammatory mediators, and this can be a couple different ways. One, cytokines and chemokines, which I already mentioned. They're the hormones of the immune system. These are small secreted proteins that allow cells to talk to each other. For now, this is kind of sufficient information, and we're going to talk about cytokines and chemokines all the time. Cytokines are actually becoming a huge target for some pharmacologic agents to treat conditions, so we're going to keep talking about them. For the acute inflammatory response, the most important cytokines are these 3. This is what I call the inflammatory triad: IL-1 beta, TNF-alpha, and IL-6. And they basically set up the inflammatory events that we just talked about. Increased blood vessel permeability, increased fat and metabolism, fat and muscle metabolism, which causes fever. They kind of set all of this up. After you get a flu shot, when you feel kind of flu-like, when people say, oh, I don't like to get the flu shot because it makes me feel like I've got the flu, they don't have the flu most of the time. What they have instead is a great inflammatory response. It's responsible for those flu-like symptoms. Chemokines, on the other hand, are kind of a specialized type of cytokine that tell cells where to go. And IL-8 is a big one for this. IL-8 is a chemokine that literally recruits neutrophils to the site of infection. It's sometimes also known as CXCL8. But that's not all. We also have lipid mediators. Lipid mediators we're going to talk a lot about once you're here in some very specific cases, and this is something that Dr. Szabo, your biochemistry professor, and I will teach together. Mast cells and phagocytes produce a lot of lipid mediators. Most notably, your lipid mediators are prostaglandins and leukotrienes. These guys are really good at promoting the inflammatory response. Sometimes when it's positive, sometimes it's not so positive if we're talking about asthma or allergy. They're a byproduct of phospholipid metabolism. So think back to, your initial cell biology courses. We have a phospholipid bilayer around all of our cells. And that phospholipid bilayer needs to be maintained, which means sometimes some of those building blocks get replaced. And so when they get replaced, those phospholipids need to be metabolized and broken down. And this is some of the end results. So waste not, want not, we're using it for something else. As our cell membrane gets renewed, we get more of them. Leukotrienes and prostaglandins can increase vascular permeability again, which leads to further infiltration of immune cells to the site of inflammation. So it's really helpful. They can also lead to vasodilation, increased capillary permeability, pain, fever. You get the story at this point. Immune cell activity. So once we've got these things, cytokines, chemokines, lipid mediators in the area, we need to actually respond to them. So mast cells in particular will release their own granulocytes, which will contain things like histamine, which we already talked about as being very, very pro-inflammatory. Same with basophils in the tissue. They can also produce cytokines and chemokines, which will further amplify the inflammatory response. Histamine in particular is complex in its effect on the vasculature. It can cause increased vascular permeability and vasodilation or vasoconstriction, depending on the context of the mast cell activation. And we'll talk about that more as we go deeper into what the inflammatory process is. Okay, now it's time to destroy some things. And hopefully we're destroying more pathogen than we are tissue, but there are some host cells that get lost in the fray. Phagocytes like neutrophils, macrophages, and eosinophils will literally eat the pathogen or irritant and destroy it. And in the case of a viral infection, they'll eat dead or dying cells. And they're recruited to the site of inflammation basically by these cytokines and chemokines, and that allows them to get in and directly attack the pathogen. Immature dendritic cells, which are a special type of antigen presenting cell, will basically pick up the pathogen, take it to the nearest lymph node, and further amplify the response by engaging T cells and B cells in the lymph node. If this doesn't make any sense to you, go back to up a couple pages to the Introduction to the Immune System video and watch that, and it'll all become a lot more clear. And if it still doesn't make sense, sit tight. We'll talk about it in September. Okay, termination. As the pathogen is destroyed, we need things to go back to normal, right? We don't want to have an inflammatory response forever. So as the pathogen is destroyed, your endothelial cells begin to repair, less bradykinin is produced, less cytokines, less chemokines, and the short-lived cells like neutrophils begin to die. And at that point, we have kind of a switch in the role that lipid mediators are playing. In the termination of the immune response, pro-inflammatory prostaglandins can become anti-inflammatory lipoxins. They go through kind of a new generation. These are going to inhibit recruitment of inflammatory cells like neutrophils and instead promote recruitment of monocytes, which are capable of removing dead cells, basically cleaning up the area after the party. And at this point, the acute inflammatory response is actually going to require stimulation to remain active. So when the injury starts to heal, it no longer has that stimulation. So now the immune response dies down and many of the cells die with it. So what would have been better is if we could have just stopped this infection or onslaught in the first place. And the first key to this is barriers. The first goal of any good immune response is to actually keep the pathogens out of the body. So for this reason, a variety of barriers exist within our body, and we're going to talk about them kind of throughout your immune and micro blocks. The barriers are passive structural barriers like your skin, which is actually, in my mind, the largest, most intact immune organ throughout the body, and chemical responses like enzymes in mucus, tears, and saliva. So the skin would be an example of a mechanical or passive barrier. Much like a brick wall surrounding a castle, it just kind of is there and is a good deterrent. The epithelial layer of the skin comprises a stratified layer of keratin above a layer of epithelial cells, which basically forms a barrier to prevent pathogens from entering the body. The barrier results from basically those tight junctions interacting with one another, and the endothelium within your body also forms similar tight junctions. We also have mucosal tissue, mechanical and chemical, that actually play a role. And so that would be things like the epithelial cells again, but also things like a chemical screen, which would be things like those the enzymes. So you can have sebum on your skin, which is basically a fatty acid of lactic acid and lysozyme that can be found on the skin that breaks down some things. In the gastrointestinal tract, we have things that are mechanical, like the flow of fluid, mucus, food, and saliva that will kind of brush things out. But we also have things like acidity, and we have major changes in acidity. So in your stomach, it's really low. The pH is like a pH of 3. But down here in your colon, it might be as high as like 11. There are very few microorganisms that are able to survive this pH whiplash from a 3 to an 11. So if an organism can survive this, it's a very hardy organism. But this is going to take care of a lot of them. And there are other kind of mechanical organisms, mechanical barriers. So for instance, everybody take a deep breath, blow it out. You just prevented an infection and maybe spread it to somebody else. Because when you force air out, you're actually also forcing microorganisms out. So that provides an example. There are also cilia, which constantly beat upward, that basically will bat microorganisms out of your airway, should they be there. So you've got a wide variety of barriers that are basically providing a front line of defense before we even engage your immune cells.